Hi, I'm Reed.
And I'm Florence, and we partnered with Durex to help bust some myths on sex and sexuality.
We're diving into the world of STIs, talking to a real expert who's been helping people with their sexual health for over 10 years.
Hello.
Good morning.
Welcome to our bedroom.
Oh, thank you for having me.
cozy.
This is very cozy, I must say.
You are a sexual health expert.
I am.
What do you do?
So, I am a registered nurse, and I've been a nurse for about 12, 13 years now.
Whoa.
I know. I look about 12, 13 myself. I know that's what you're going to say. That's why we'll roll with it.
Gorgeous.
And I have been a sexual health nurse for 8 years.
So there are a few myths sort of floating around about STIs.
One or two.
What are the craziest you've ever heard?
God, it's like asking how long a piece of string is. It's really hard to say. Right, myths that you can catch an STI from a toilet seat.
Yeah.
I've
thought
that.
Yeah.
Like, gotta wipe the seat just in case.
Just in
you
case,
know?
just in
So you
case.
can't get an STI from a toilet seat?
You can't.
Okay.
No. So if you think about STIs, sexually transmitted infections, so that means that you can get them from sexual contact.
Okay.
So whether it be mutual masturbation, oral sex, penetration, that's how you catch an STI. You're not going to catch it from other, just touching or sitting somewhere.
And what about if someone did the same thing, fingered you with a bit of semen in, could you get pregnant?
No.
No?
No. No.
We're not going to get some milk.
I mean, there's going to have to be some very strong swimmers. I mean, the swimmers, Olympic swimmers, they would have to be. But
And a very fertile lady.
In a very highly fertile lady. But no, you cannot get pregnant from being fingered.
Okay.
Yeah, but that is a myth.
Yeah.
What else? So I remember doing sex education in a secondary school, which is probably like the most daunting and scariest thing you could possibly ever do. A room full of teenagers, and you say, ask me anything about sex. The first question that asked me is, what does semen taste like? I didn't ask that question.
Taste it yourself.
I didn't ask that question. I was like, yeah. So another thing that young people tend to ask is that if I wash my vagina with vinegar after sex, would that reduce? Would that kill any infection?
Vinegar, like fish and chips vinegar?
Vinegar, nail polish remover.
Oh,
I did sex education for girls, and I did one for boys and one for girls. And a lot of the girls were like, because I heard that if you use like things like alcohol or anything that has like strong chemicals
shoving
in it,
a bottle of vodka in
you
there,
can just clean your vagina after sex, and that will stop you. That will kill the bacteria. And I was like, do not put alcohol or vinegar or nail polish remover on your genitals. Ever for anybody. No, that's not the way it works.
That's horrifying.
Horrifying. I was like, oh God, I crossed my legs after that, I must say.
Yeah.
So what I also hear a lot, and this is probably the most common misconception, is that you cannot get pregnant from pre-cum, and that if you use the withdrawal method as a form of contraception, then that's good enough. So a lot of young people come in and they say, but I didn't come inside of her. And I'm like, okay. Oh, he didn't come inside of me. I'm like, but you do realise that during sex, men do, produce sperm even before they've ejaculated.
Yeah.
And even though, yes, the risk is lower with just pre-cum from getting pregnant, but it is still very much a risk. And as a girl, you may not always know whether that person's ejaculated inside of you or not.
Yeah.
They may say, oh no, I didn't come inside you.
What about the passing of STIs in that case? Could you get the STI without the ejaculation?
Oh, yeah. So whether somebody ejaculates or not, if you're having unprotected sex, you're putting yourself at high risk for chlamydia and gonorrhea.
How common are they? Do we need to be worried, or is it something that's just there? It happens.
It happens. So the most common infection is chlamydia. So chlamydia,
I've had it.
Yeah, it happens.
I haven't had that one yet. I need to take it off my list.
It's like catching a cold. Right, so chlamydia is the most common STI. It makes up about 49% of all infections diagnosed in the country. So it's the most common infection. It's also one of the most easiest to pass on. So it's a bacterial infection, and it's a localized infection, meaning that you can catch it anywhere where you have sex. So you can catch it in your vagina, you can catch it rectally, and you can catch it in your throat. Because a lot of people think you have to actually have the penetration to get an STI. So a lot of people think, I don't want to get an STI, so I'm just going to do oral.
Yeah.
And most people typically don't use protection for oral sex. If you give oral sex to somebody with a penis, so whether you're male or female, if your sexual partner has a penis and you give them oral sex, the best way to protect yourself from an STI is to wear a condom.
Or a condom using during oral?
During oral. I know most people don't, and that's up to, you know, each individual to make that decision for themselves. But if you do want to prevent chlamydia and gonorrhea in your throat, then condoms are the best way to do that.
Yeah, I think probably because people don't think that they can catch anything that way. They're like, oh, why would I need to use a condom during oral?
Yeah.
And
And
at least there's flavoured condoms these days.
That's exactly what I was going to say. So if you don't like the taste of maybe condoms, which shouldn't have like a distinct taste anyway, most condoms, but if that's a thing, then you can use flavoured condoms, and there's all those sort of options.
Are there any other STIs that you can get in your throat?
No, so mainly just chlamydia and gonorrhea. There are other sort of infections that you can get in your mouth area, things like, you know, herpes, which is part, you know, the HSV virus, that causes the cold sore. So it's a type of sexually transmitted, but it's a little bit different in that you can catch it in other several ways that's not exclusively through sex.
Oh yeah, my grandmother gave me herpes on my neck when I was 9 years old.
Oh yeah.
Thanks, Gma. Thank you.
Parting gift. No.
It's literally a parting gift. I remember her every time.
Oh, bless. That's why I always tell people, never kiss newborn babies, like, because you never know if you have the HSV virus, and that you could potentially have a small cold sore that you've never even noticed. And that's why I always tell people, don't kiss babies, like, don't do it. So we were talking about PrEP before, and PrEP is great. It's great for people who are considered high risk for HIV, because like I said, it's seen a massive reduction in HIV diagnosis. But because of that, what we're seeing is people are taking more risks, especially within the LGBTQ community, because now it's like, oh, okay, well, we've kind of covered HIV, we can take this drug and stop us from becoming HIV positive. But with that, other STIs have gone up in tenfold. So we're seeing a lot more gonorrhea, we're seeing a lot more syphilis, and what we're seeing as well is, and this is generally speaking, antibiotics are very clever things. We've been obviously using them for a very long time, but antibiotics are not as strong as they used to be. And so now more than ever, we need to make people aware about STIs, because what we don't want to do is just bombard people with antibiotics and then they become resistant later on in life.
So the antibiotics don't work.
They don't work as well as they used to. So with chlamydia, we've changed the treatment slightly. With gonorrhea, we've changed the treatment slightly. So we're constantly looking for new ways of treating them because of this resistance.
Medicine's always changing and getting better and growing. So, you know, whatever they throw at us, we'll throw it right back.
That's right. So I don't know about you guys, but when I was in school about 100 years ago, there was very, very little like actual information that was of value to you.
Oh yeah, it was all fear,
wasn't it? It was kind of like, this is periods, this is how you make a baby, wear a condom. And I went to an all-girls Catholic school as well that was mainly run by nuns. So it was kind of like abstinence and condoms, and basically that's it. We didn't talk about sort of body image, we didn't talk about consent, we didn't talk, because also in school I thought sex was just a penis inside a vagina. And everything else around that was foreplay. But actually oral sex is sex without penetration. Anal sex, there's so many different acts of sex that don't always involve one or the other genital either. And you don't get taught about these things, you just get taught about sort of the generic, the basics of sex. You don't learn about STIs, you don't learn about symptoms. You know, if you're a young girl, you're going to get your period when you're in secondary school. Up until my 20s, I just thought, okay, my mood changes were just a personality trait. No one told me that actually once you'll start menstruating and your hormone levels changes, which is normal, you may experience different variations in your mood, physical changes, mood changes, and nobody explains these things to you.
No, not at all.
For me, you know, coming out of secondary school, I had very little information. And young people nowadays, but I mean, when I was in school, I was lucky in that we didn't have social media. So you sort of go to school, you go home and you're away from that. Whereas now the internet is there, it's not really policed. There's a lot of information.
Misinformation as well.
Misinformation, and it's kind of like everything's everywhere. Young people are getting information from everywhere, and there's nobody sort of saying, right, yeah, this is Instagram, but these pictures are highly filtered. You don't have to look like that. Real women don't. Sex is not always like that. It's not always glamorous. You know, it can be messy. This is how STIs are caught, and just little things that are going to actually help young people.
And you don't get taught what to do if you think you have any symptoms, or like how often you should go to the sexual health clinic. What should people do? Like, how often should we be going to the sexual health clinic?
So it depends on, so everybody's different. So it depends on, you know, it depends on who you have sex with, essentially, your sexual orientation, how frequent you have sex and what you do. So what I would suggest is for heterosexuals to screen about every 6 months for chlamydia and gonorrhea, and about once a year for a blood test for HIV and syphilis.
Great.
Reason being is that if you're, with the blood test, is that if you're a heterosexual living in a country like the UK, HIV is very low. You know, it's a low risk country. So heterosexuals are not a high risk group for things like HIV and syphilis. So about once a year is fine for a blood test for that. Every 6 months for chlamydia and gonorrhea. So with a male, that would entail a urine sample, and with a woman, it would entail a vaginal swab or a rectal sample if you have anal sex as well. So let's say you have sex with somebody today and you think, okay, right, we didn't reach protection and I'm worried about an STI. The minute you think, oh God, I think I might have an infection, I think I put myself at risk, the first thing you think is, right, I'm going to go to the clinic, which is good, and it's good, you know, but it does take a certain length of time for each infection to be detected on a test.
Are there always symptoms as well?
No. So this is why I always say, if you do have a swab every 6 months, even if, let's say, you tested positive for chlamydia, we'll know that you've not had it for more than 6 months if you're doing it regularly.
Yeah.
With women, we can actually have infections like chlamydia and gonorrhea for a lot longer without any symptoms, unlike men. So men are more likely to present with symptoms like pain passing urine, discharge, sort of an irritation. Whereas with women, because our vaginas are very special and very magical, you know, we can.
Thank you.
Yes, the look after. So, you know, we can actually harbour infection for a lot longer with no symptoms, but eventually your body will start to tell you that there's something going wrong. So as a woman, what you should look out for are things like spotting, so a little bit of blood when you're not on your period, pain during sex, and shooting pains down in your pelvis. They could be indications of something like PID.
Yes.
Pelvic inflammatory disease, which is quite common.
That's just women, right?
Yes.
So I got that clear.
Yes, that's right. Now, what we find is that men who have sex with men typically change partners a lot more, and so therefore there's higher risk for infections within the gay community. So what we suggest for men who have sex with men is to screen every 3 to 6 months.
Is that also because having anal sex, you're more likely to tear skin, or is that just a myth?
So unprotected receptive anal sex, so that means when you're bottom, that's the highest risk for HIV. So with gay men, we always say that if you're, especially when you're receptive, first of all, we now have medication that can stop you from becoming HIV positive. We've got something called PrEP, which is pre-exposure prophylaxis, which is essentially like how us girls take the pill every day to stop us from getting pregnant. That's the easiest way to describe what PrEP is. So it's available for anybody who is considered high risk for HIV. So people from high risk countries, people who may be sex workers, and men who have sex with men. So that's like a long term, and we know it works. And ever since PrEP came in the market, which has been the last couple of years, we've seen an 80% reduction in new HIV cases, which is
amazing.
Incredible. Yeah.
Wow.
So the plan is to get that number to zero and to to essentially get HIV new diagnosis to zero. But also in tackling HIV diagnosis, we also want to tackle the stigma, educating everybody, whether you're considered a high-risk person or not, about HIV. And I think that's how we destigmatize it as a virus.
Yeah.
If we all know about it, then you won't get people coming into clinics saying, oh, you know, my housemate has been tested positive for HIV and I'm really worried. And then you'll say, okay, well, when did you have sex with your housemate? They're like, oh my God, no, we're friends. And it's like, okay, well, clearly there's some gaps in knowledge about how HIV is transmitted. So the more we all know, then the more likely we are to destigmatize it.
Yeah. And if you're taking medication for HIV, you can't pass it on anymore.
Yep, you can't pass it on. So if you're HIV positive and you're what we call undetectable, which means that you're still obviously HIV positive, but the level of the virus in your body is so low that it can't be picked up on a blood test. Meaning that if you're on effective treatment, even if you have unprotected sex, you cannot pass the virus on.
Amazing.
What about bisexual women and gay women? Is that how often should they visit the sexual health clinics?
There is this myth that women who have sex with women don't get STIs, and you're low risk, therefore we don't need to think about you in health promotion adverts and stuff, which is completely false.
Yeah.
Yes, if you are a gay woman or a bisexual woman, your risk is lower for infections generally, but you still very much can get an STI.
Absolutely.
So if you have sex with women, if you're a woman who has sex with women, especially when you're using sex toys, especially in in group sex environments where people use toys and maybe they might use it on several different people don't always think that you should clean a toy or even put a condom on a sex toy. It seems like almost ridiculous. You think, well, it's a toy, it's not a person. I'm not going to get an STI. But if you think about it, if you're inserting that into somebody's, anal cavity or vagina or anywhere, and they happen to have an infection, you take that out, you use it on yourself or somebody else, the infection will still live on that dildo or that toy, and then that's how you can then pass it on. So even just teaching gay women about washing toys in between use, using condoms as well, how to use lube safely, so not to use silicone lube with silicone toys, because that's not a good thing. These are the type of things that we want to and we need to sort of target with gay women as well.
I had no idea that you can use silicone lube with silicone toys.
Yeah, I mean, do you know what? learned that about 6 months ago as well. We're all constantly learning when it comes to sex and relationships, and it's all trial and error. And you have good brands who try different things and find gaps in markets and different types of lube. We've got loads of different types of condoms than we've ever had before. A lot of people don't like using condoms. They say, oh, I don't enjoy sex as much. But then now there's no longer that excuse anymore because
there's one for everyone.
There's one for everyone, exactly.
And with sort of evolution of social media and dating apps, people are having more sex. Yeah. So is that why there are more STIs going around now?
Yeah, I think people are having more sex, people are changing partners more, people feel a lot more sexually liberated. I think women's approach to sex has changed, in the last 10 years. It used to be sort of like, there's a lot of shame attached, particularly if you're a woman, and owning your own sexuality and being very vocal about your sex life, and just even being, vocal about enjoying sex and talking about it. It's always like, you have to be a lady and stuff like that, and you can't talk about sex. Dating apps mean that it's easier to hook up with people. You don't even have to leave your front room or your bedroom to meet somebody nowadays.
They just come to you.
You can order sex like you order a pizza. Exactly. Like there's all these different apps, and it's like, okay, there's a lot going on for people.
So you don't want to stop people from having sex.
No, it's not about, it's not our job to tell, everybody has the right to do as they please with their body. I always say, as long as you're not hurting yourself or hurting anybody else, then it's fine. And as long as we give everyone the right tools, the right information, so that you can say, right, if you want to have unprotected sex with 10 men in a weekend, as long as you know that this is what could potentially happen, these are risks, these are facts, then you get on. But as long as you know and you can make that informed decision.
Yeah. And treating everyone equally, no matter what they choose to do with their sex life.
Yeah, I mean, I work with sex workers, I work with trans people, I work with young people.
Non-monogamous.
I work with people over the age of 45 who are a high-risk group, actually, that's not targeted, because you assume, why is my auntie going to have an STI? But we don't target this group of people. So we're seeing an increase in... Yeah, because divorce rates have gone up, so there's a lot more single older people than there used to be.
So interesting.
Yeah, so people always think, oh, yeah, so you only have to be 16 to catch an STI. Well, actually, you could be 60, 70. I see, 70-year-olds come out of the closet and then go and have, like, the best 6 months of their time.
Goodness,
come back rectal gonorrhea,
the best time in the old folks' home. Put me away, having the best parties, get with everyone.
How do we stay safe in this kind of STI landscape?
So the best way to keep safe is to wear protection. So condoms will always be the best way to protect yourself against an STI. I mean, we talked about things like PrEP and PEP and other medications that you can take, but essentially chlamydia, gonorrhea, syphilis, only condoms are essentially going to stop you from catching these infections. And because they are on the increase now, you're more likely to catch an STI than you were 5-10 years ago. Yeah. So wearing condoms, always making sure that you have one, especially when you're going out. And also, condoms are not just the responsibility of the person who has a penis.
Exactly.
So true.
Yeah, so it's always like, okay, you carry a condom in a wallet, but you should carry one in your purse as well. If you know there's a chance you might have sex or you want to have sex, then and you're going out, whatever, carry one. It's not gonna.
Yeah, why not? Harm. It doesn't make you look like a slut or like a lad. It actually makes you look real hot. Sexy.
Yeah, responsible.
Yes, exactly.
And then how more likely are you going to enjoy your sex when you're having sex with somebody who pulls out a condom? Then you're going to be like, oh, okay, well, you're clearly not somebody who just does this with everybody. If we just met and now we're having sex, then at least it makes you feel a little bit comfortable about your sexual partner.
Feeling safe.
Because it's always a little bit scary when they're like, oh yeah, I'd rather not use a condom. Oh, I don't have one. It's like,
how many times have you said this to
somebody else? Where have you been?
Yeah. So it's everybody's responsibility, essentially. Yeah.
What kind of issues are you seeing with men, well, really of all ages? Is there anything that's coming up that we can focus on or talk about?
With men, I think one of the things that's sort of a hot topic, which is great, is sort of mental health and that kind of thing, and sort of getting men to open up a lot more and talk about sort of feelings and relationship stuff and their, body image. I think what we see a lot of is that, body positive movements are typically targeted more at women, whereas men also experience the same issues as women do. But because I think historically it's always been more that women are expected to be a lot more emotionally charged and be a lot more in tune with their emotions and feel able to talk about their emotions. But I think as a society, we also have a lot of expectations of men and what a man should be, and you know, boys don't cry, and like you don't talk, and boys
Toxic
don't talk about
masculinity.
toxic masculinity, and boys don't talk about what they go through the same way us girls would do, especially in clinic, and especially with younger guys now. I am finding that they're a lot more open to talking about their feelings and relationships, fears, body issues, things around sex. A lot of young guys worry that they're not pleasuring their partners, and they feel a lot more empowered to speak about that now. I am seeing young guys coming and saying, look, how can I improve my sex life? How can I last longer in bed? How do I know if I'm pleasing my partner? And which I think is amazing, because I'm sure our grandfathers would have never been in a position to ever speak about these things. So the fact that men are, you know, we sort of, it's sort of an evil level playing field when it comes to emotions, and being able and feeling empowered to talk about it is an amazing thing.
And do you think that's to do with social media or the internet, that they're able to talk about this more?
I think so. I think the internet, social media has completely changed the world upside down. I think, you know, it's created opportunities, it's created communities, and it's created platforms for people. It's brought people closer together. You know, the people that they look up to, celebrities and people in the public sphere. And I think people in the public sphere are really important in that when we talk about things that we experience just as human beings that we do, whether you're I don't know, Beyonce or like whoever, every human being has things that they go through. And I think nowadays we're encouraging each other, and people in the public eye encouraging each other to talk about things like body image, things like HIV. I know Gareth Thomas, who's one of the greatest sportsmen in our country, he came out as HIV positive recently. And I think giving a face to infection normalizes it. So like you said, I had chlamydia once, and it's like, that's normal, and you know, you're on a podcast, you talk about it. So if I'm a young person and I've had chlamydia, and then I go on your podcast and then you're talking about it, I'm gonna feel, like, okay, it's not just me, I'm not just some like dirty person, it's normal. It's like catching a cold. You never tell somebody who's got a cold that they're dirty.
So what can us ladies look out for when we need to go to the doctor?
Okay, so first of all, don't look out for any symptoms before you go to the doctor. Do a screen every 6 months, but if you do have symptoms, the type of symptoms to look out for are varied. So one of the main symptoms that girls present with in clinic is an increased amount of discharge, vaginal discharge. Now, vaginal discharge, first of all, is normal.
Yes,
it is normal. As women, you have to have discharge. It's your body cleaning itself. So the vagina, like I said before, is very clever. And it's self-cleansing, so you don't need any of that fancy soaps and stuff that they sell to you in shops. You don't need
discharge does change throughout the month as well.
Exactly. So depending on different times of the month. So for instance, when you're ovulating, you're more likely to have discharge, and also the consistency of the discharge might change. It's sort of a lot more gel-like and see-through. Other times it's a lot thicker. So different things in the month can, different times of the month your vagina can be different. Most of us know what's normal for us. You know when it's a little bit abnormal for you. So discharge can also be an indication of an STI. So something like chlamydia or gonorrhea. If it's gonorrhea, it's typically going to be sort of like a yellowy, greeny type of discharge. If it's chlamydia, it's more likely to be a liquidy, sort of more of a runnery type of discharge. Things like thrush also cause discharge, and bacteria vaginosis, otherwise known as BV.
Are they STIs?
They're not STIs. So they're caused by an imbalance in bacteria in the vagina. That bacteria that causes the imbalance could be caused by loads of different things. So things like washing with soaps and shower gels, which I know there's some brands out there that sell women like different types of things to wash underneath. But like I said before, the vagina is self-cleansing. You do not need any soaps or shower gels
just
down
water.
there. Water alone is absolutely fine. So with thrush, the typical symptoms are a really thick discharge that tends to be sort of white, yellow, sort of in between that kind of colour. And it's quite distinctive in that the discharge is very thick and it's almost like cottage cheese.
Yeah. Ooh. I've had that before.
Have you had it before?
Oh, yeah.
Once you've had thrush before, you know what it is if you have it again.
Okay.
The discharge is very distinctive. Like I said, it's quite thick, so it would be different to your normal type of discharge. When you have bacteria vaginosis, which is again caused by an imbalance of pH levels in the vagina.
I've had that too.
Had that too. Tick that off themselves.
Yeah, all of them. Woo!
That's
smelly,
most,
right?
if not all women will get BV or thrush at some point in their life. Some women, unfortunately, do get it more often than others. Now, what is also important to realise and to acknowledge for girls is that having sex alone can trigger off BV or thrush. Now, not to say that your partner has given it to you, but if you're having sex with a new partner for the first time, their bacteria and your bacteria is very new to each other. So it could just having sex, the act of sex alone, vaginal sex alone, could just trigger off. And especially if having unprotected sex. So when you use protection, that bacteria is not joining, and it's not then creating a pH imbalance, and then you're not likely to get thrush or BV. So the best way to protect yourself against thrush or BV is through protected sex. Okay. If you do get an outbreak of either of them, it's not the end of the world. You can pass on thrush from one partner to the next through sexual contact. So if you have a vaginal thrush, you can then give it to your partner. So in males, the symptoms might be sort of the skin feeling a little bit sensitive, maybe the colour might change, a bit of redness around the head of the penis, and general irritation in that skin. So guys can pass it on to girls as well through sexual contact. But with BV, you cannot pass BV on to a guy. A guy can essentially cause you to have an outbreak of BV, but you can't then give it back to them.
Okay.
No. So it's only exists in the vagina. But the symptoms for BV can be quite unpleasant. So it can be sort of like a fishy type of smell. They're very distinctive.
You know when you have it.
If you've had BV once before and you've been diagnosed, you know what it is every time you get it, because the smell is essentially the same. It's like a typical fish-like symptom.
Yeah, it is, isn't it?
And it smells the same for every girl that gets it.
That must be where the joke comes from.
Yeah, that's exactly. So whenever you hear the joke and people are like, oh, her vagina smells like fishy, that's where it comes from.
It's just BV.
And it doesn't mean that you've not washed. It doesn't mean that you're dirty. It's just, unfortunately, that's just the symptom of how it smells. And it's not very pleasant, and it can cause a lot of insecurity. It causes a lot of fear. You think, God, my partner thinks I've not washed, and it's nothing to do with that. Actually, sometimes it's caused by washing too much.
Yes, I've heard of that.
Because when you overwash, and because a lot of women go really inside and want to never do that, because you're just washing away all the good bacteria that your vagina needs to stay healthy.
Good advice.
So say I was going to the sexual health clinic for the first time, what should I expect? Because I'm a bit scared.
So when you go to a sexual health clinic, first of all, the first thing that I always tell my patients, especially first-time patients who are like, I'm a bit anxious, come to the clinic, I'm a bit scared. First of all, remember that you are going to leave, so nothing terrible is going to happen. The second thing I would say is everybody that you see in the waiting room is there essentially for the same reason. Everyone's there because they care about their health, they're being responsible adults, and they're doing, the right thing, the right responsible thing. So by being there alone, that tells you that that's a good thing to do. Second of all, everyone that you see, because they think, oh God, I'm going to talk to the nurse or the doctor about my sex stories and I'm really embarrassed. As a sexual health nurse or sexual health doctors or healthcare advisors or healthcare assistants, everybody who works there has chosen to specialise in sexual health. So we're not prudes. Feel reassured that the person you're speaking to is professional, and also remember that they've probably seen about 30, 40, 50 people that day. And in the grand scheme of things, your story, even though it seems like the biggest thing in the world and you're like, oh my God, I'm so scared, I'm so embarrassed, I've heard all sorts of things.
You've heard it all
on my lunch break. So there's nothing that anyone's going to say that's going to throw me off and make me think, oh God, you're a terrible person. So we don't judge, anybody who has sex, any type of sex, it's completely confidential. We don't share any information that you share with us. Also, when you come to a sexual health clinic, typically we only ever use your name to call you into the consultation room. So other than that, you are a number. That number can't be tracked to your GP practice, because that's another thing that a lot of people worry about. Are you going to share my information with my GP? Because a lot of people still share their general practitioner with their family. And also, especially with guys worry, oh my God, are you going to put that umbrella thing? And they always go like that. Are you going to do that? And I say no. Unless you have symptoms, if you present with things like, pain, passing urine, discharge, yes, of course, there are instances where we are going to have to take a penile swab, but having a swab taken compared to having discharge for weeks.
No.
You want that swab.
It's worth it.
You need
it's
that
worth it. And also, if you're screening regularly, you can avoid that swab. If you do a urine sample and we pick up an infection, great, we've picked the infection up, we can give you antibiotics. You don't have to leave it to where the symptoms have progressed so much that we then have to do the swab. And if you're a girl, you do your own vagina swab nowadays.
Yes, I've done that at home.
You've done it at home, yeah. So nowadays with this, amazing online life that we all live, you can order a test kit. It comes to your house. You can you draw the blood from yourself for a HIV and syphilis blood test or hepatitis if you need that. You do your own swabs yourself. You can send it off. So there's so many different options for testing that you're no longer restricted to to going into a clinic.
And worst case scenario, if you do have to do that, they are so lovely, and all the nurses and the doctors, they know exactly what they're doing. I've never felt more comfortable, even when the bottom half of me is completely nude.
Yeah, and it's
so
like
nice.
the idea of something is always worse than the reality. But because you're scared of the outcome, people are scared of the results and what that could potentially mean. And so they put it off. But eventually your body was just going to be like, look, mate,
Can't handle.
can't. Yeah.
So don't put it off.
Don't put it off.
Go to the sexual health clinic.
Sexual health
Carry a condom.
Carry a
Always
condom.
use a condom.
Like one of those like sexual health clinic cards, just swipe in, done deal.
Yeah, done deal, yeah.